afternoon. This is Dr. John Bennett broadcasting from Miami Beach, home of Neurosurgical TV. Today we have the honor of having Dr. Ehenga. He's a resident from Africa that's going to give a presentation. And before I turn it over to Dr. Ehenga, let's meet a few of the panelists. Good day, Amir. Unmute and introduce yourself.
Hello, everyone. Hello, everyone.
Who are you?
John, are you talking to me? I'm sorry, I didn't hear
Yes.
you.
Who are you? We want to know who you are.
Hi, everyone. Sorry about
This
that.
is not America's Most Wanted.
Sorry. You know, I'm Emir. I'm a medical student from Iran. And yeah, I'm here for you. Just about that, you know, ask me everything.
Very good. Welcome. Welcome, Dr.
Thank you.
Kabulo.
Hello, everyone. My name is Kabulo. I'm from Democratic Republic of Congo. Currently, I'm final year neurosurgeon resident at the University of Zimbabwe. Nice to meet you all.
And a longtime supporter. How about Nabaz Mohammed? Can you hear me okay? Perhaps not. Raciel, Mohammed, Adria. I know Adnan is there.
Yeah,
Go ahead, Adnan. Go ahead.
yeah, it's me, Dr. Adnan Qasim from fourth year neurosurgery resident from Pakistan.
Okay, welcome,
Yeah,
Adnan.
nice to see you, everybody here. Good form. Yeah.
Okay, very good. Well, okay, why don't we go ahead, Dr. Ehenga, and it's all yours, and thank you.
Okay, thank you so much, Dr. Bennett. And this is a great opportunity for me to be invited here. I'm Dr. Ehenga Idimarse from Congo, Democratic Republic of Congo. I'm training in Uganda, Mulago National Referral Hospital in surgery at COSEXA.
Okay,
Thank you so much.
Let me know when to start. Okay, let me straighten it up first. Is that okay?
Yeah.
Okay, tell me when to go forward.
Yeah, thank you so much. Today I'm presenting on a trauma course in Congo that we named National-Wide Scale-Up of a Context Specific Trauma Training Course in Congo. In this course, we are training medical doctors. In general, we are training healthcare professionals in how to handle trauma patients in Congo, nationwide. Next. Yeah, in this presentation, we are going to talk about, we are giving a background, objective and methods, results, conclusions, and challenges. And we will finish with a take-home message. Next.
I'm sorry. Okay, there we go.
Yeah, in this background, I would people to realize with me that every injured individual should have access to and has right to adequate and effective trauma care. That is a life or limb saving, and this has been said by Dr. Ling Haung, WHO representative in Nepal. But how to do this? Next. Yeah, in this we are saying that trauma account for 10% of the global burden of disease in the world. And in this we have road traffic injuries, self-harm, falls, and interpersonal violence. All of these contributing greatly to both mortality and morbidity. And we have more than 5.8 million deaths worldwide due to injuries. Most mostly in children and young adults. So we have 1.2 million people died annually by road traffic accident. 90% of them are in low and middle income countries, unfortunately, with an estimated cost of more than 500 billions US dollar per year. Road injuries are the eighth leading cause of death globally in this part of the world. And middle income countries. Next.
Sorry. Okay, there you go.
And unfortunately, where we have all this burden, Africa is among that part of the world. And in Africa, we have a limited qualified surgical workforce, and specifically in sub-Saharan Africa region. And in here, we wanted to highlight the contribution of the College of Surgeons of East Central and Southern Africa, COSEXA, over last 20 years. In these 20 years, COSEXA has trained more than 340 specialist surgeons. Among them, we have 49 women's. And this course of a trauma course has been given in this region by Primary Trauma Care Foundation from England. And now this course is run in more than 70 countries worldwide. And COSEXA has built a link with the University of Oxford called COOL, which is COSEXA Oxford Orthopedic Link project. Under this project, many doctors in this region are trained. Among doctors in Congo, we are training them under this, but Congo is not covered by this project of COSEXA. Next. And we want to look at some causes of death in Africa, in Congo specifically. Over 10 years, from 2007 to 2017, we can see here some causes of death. We can see malaria, how malaria decreased, how respiratory infection decreased, HIV decreased. You can see here from 2007 to 2017, HIV have decreased over 64%. Why? Because there are much found in fighting HIV in the DRC. Malaria, same. But you can see road injuries from 2007, it has increased of 12%. And we can ask, why this increase? Why this increase over 10 years? And why this decrease over 10 years for HIV? The reason is simple. They found there are many projects for HIV, and for trauma, nothing is being done. No project for trauma, and that is why we decided to do something in Congo to train doctors, to train nurses, and trying to improve a little bit this situation, which is going in increasing. Next. Yeah, according those causes of most premature death, because you can remember I said these deaths are in those young people. We can see here again in 2007, malaria, how it went. It decreased over 37%, HIV 63.2%, but road injuries had increased over 7.5% of death, premature death. The reason is the same. People were not trained. A hospital could train its personnel, but not concerning all the country. Next. Yeah. What is about the most death and disability combined? We can see here other causes of this disability and death are going in decreasing. We can see them in red, congenital defects, but road injuries went in positive way, and it increased over 10%. HIV went in negative, in decreasing, and the reason we have already given this reason of this increase and decrease in other causes. Next. Yeah. What is the situation in DRC? Like we are talking about DRC, we can see here the population of DRC is over 80 million population. Compared to the population of the world, it's 1.13% of the total world population in DRC. But for this whole population, the situation we can see here, the situation is worse. Why? Because wars, road traffic accident, volcano, and those volcano and flood. But there is no well-established trauma training program in my country. But we are trying to do something for the country so that we can change this situation. In DRC, we can see that the program was introduced in DRC in 2016, in Congo Central region, and in Goma in 2019. And it was introduced by Surgical Club in Congo, which was created in 2008. Trauma training course would be the key response to this situation. And we can see here, this red color, this is Congo Central region and Kinshasa, and the other side, eastern part is Goma. And we can see that all the internal part is empty, no trauma training. Nothing is done in this other part. Only in two small parts we are trying to train and to change this situation. And we hope that one day we arrive to improve and to change the situation. Next, please. Yeah. What we aim and which method we are using. Here, this course we are giving in Congo, we use a method of 2-1-2 day course. It's like we train a group of like 20 healthcare professionals for 2 days. We deliver a course, a PTC, a primary trauma course for 2 days. And from this team, we choose like 10 people who will be trained like trainers. It's like the third day we do training trainers. The training trainers of these 10 people who will again train others for 2 days after their training of trainers. Increasing capacity on trauma care in DRC, we are aiming that, sustaining a trauma training approach. Strategic training hubs located in Goma and Kinshasa. Faculty members are from Surgical Club in Congo and serve as leader instructors And all of them have been trained under COSEXA, which is College of Surgeons of East Central and Southern Africa. Participants are selected from hospitals in Goma and neighboring cities like Sake, Kiroch, and others. In Kinshasa, we select in hospitals from Kinshasa like we did in January this year. Next, please. Yes, like again, we want to train people. We can't come and directly we train. We need to know what level we found these people with. For that, we do a pre and post baseline demographic surveys. Then we do like a pre-cost test. After the pre-cost test, we train. After training, we do again a post-cost test to know if how the cost has impacted, has changed their way of managing these trauma patients. And here, you can see how we do demonstration. This is demonstrative sessions. Like here, we have a chest of a goat on which we are training those medical professionals how to insert a chest tube. We can't say it like theory. We have to present by practice, and everyone has to practice how to insert a chest tube. Because this trauma patient, most of them, they will develop a pneumothorax, a hemothorax. So these people have to know exactly how to do it. That is why we put these demonstrative sessions, and we do it everywhere. We can see here, left side below, we can see some materials we use for chest tube and other demonstrative sessions. Here below at the right side, we can see we have a part of intestine on which we are showing these people, we are showing these doctors how to do like anastomosis. What we have to do. And this we do it when we are demonstrating what we call damage control surgery in trauma patients case. Please, next. Next, please. Yeah. As when we are training, we have done this pre and post test. We need to have results. We need to know which level pre-course and which level after course. Here we have some graphics like January 2019. We got like 51.8% of improvement. We follow when we reach the area, they had a level like 37.9% of success when we did the pre-course test, and after course they reached like 89.7% of success, and the improvement was of 51.8% if we do the calculation. And here in East of Congo, we have delivered so far 4 courses as like 1 per term, starting by January 2019. So far, 126 health professionals have been trained. 45 of them medical officers without surgical training. We capacitate them. 23% of nurses and 3% were surgeons. 29% were interns. And so far, the good news is that we have trained so far 12 new instructors in East of Congo who can train others without us because they have all capacities to do it. In May, we have got improvement of like 34.9% of improvement because they started by say 57.7% of success. Next, please. So, going to my conclusions, I can't finish this presentation without giving some challenges we are facing in east of Congo, in Kinshasa, for training these health professionals. So far, we have 2 training hubs established in Goma and in Kinshasa with this number of people trained. We want to sustain a scale up of trauma training, which is essential for increasing this capacity in DRC. We want this was a demand from COSEXA. We were asking to COSEXA to accreditate hospitals in Congo for training surgeons, because if we have this in Congo, some hospitals training surgeons under COSEXA, we will improve this. And doing this will be the key response for this above local burden in DRC. Evaluation of the cost for long impact, we are doing this now because we have a survey. People have to tell us how the cost has impacted their management way of for trauma patients. So this survey is ongoing, and after this we are going to publish results this year, maybe in December at COSEXA conference or everywhere we can present it. And this, we have difficult accessibility and the lack of equipment in DRC. Some places there are not good roads. We have difficulties to access some area, and some other areas there are wars. Like not far from yesterday, I heard in Ruchuru, a car from Goma got in an ambush and people died. Imagine if we have to go to train people and people are killed. You kill doctors who are going to train. This is very difficult, but we are trying to do whatever we can to help the population in our country. Next, please. So there is a take-home message to all people who are following this presentation. We want to implement a real trauma training in DRC because we need it. I present all statistics. I present how the situation is bad for trauma. And we need this course to improve a little bit the situation. And we are seeing how the Ministry of Education can insert this program in undergraduate and postgraduate program in Congo, and it will be a good thing. We are asking we ask to COSEXA to accreditate some hospitals in Congo for training surgeons, and surgical club in Congo can't achieve this mission without you, without people following, without other organizations. We need people to go with us because the way to go is still long and difficult, but it is not impossible because together we can. And in the following slides, please next, we are giving a message. It's an African proverb. Next, please. Next, an African proverb which says, you want to go fast, please go alone. But if you want to go far, please go together with other people. Surgical Club in Congo want to go together with other people, with Dr. Bennett, with other people. Thank you so much. Thank you, Dr. Bennett. Thank you. If there are some questions, we answer to questions.
Dr.
Yes, thank you very much. Okay, any comments or questions from the audience?
Thanks, Dr. Ehanga. Very good presentation.
Go ahead.
Thank you. Thank you.
Okay, Dr. Kubulo, you have any comments since you're a neurosurgeon from the Congo? Are you there,
Yes,
Dr.
thank you
Kubulo?
so much. Thank you, Dr. Ehanga, for that beautiful presentation. Sorry, maybe I missed something. How many centers are you doing there? How many centers in DRC?
Yeah, so far we have created 2 hubs for this training under surgical club in Congo. We have one in Goma, which is used for training for doctors from Goma and surrounding cities like Kirocha, Sake, and some others from like Bukavu, you know. And the other one, we have another hub in Kinshasa. We are training people from doctors from Kinshasa. So far we have 2.
Okay. Any
Okay, thank you so
plans?
much.
Any plans to increase in the future, in the near future?
Yeah, in the near future, we have a plan to extend. We have a plan to extend it in Maniema, in Kindu, Bukavu, Uvira, and Central Congo, like Kasai. We had a plan for this year. Unfortunately, not depending on our willingness, this corona outbreak has made us not to work, because we had a plan for April and July and October, training in Kasai, Kindu, and somewhere else. But this outbreak has stopped everything everywhere you are. You can't move. That was the plan for this year. But I think we are going to resume and do it.
This is on a somewhat related topic. Are there any active recruitment of like specialties like neurosurgeons and trauma surgeons? Or is the Congo trying to go to other parts of the world to get some doctors to fill? There's a shortage, probably, right?
Come again?
I think Dr. Kabula, how many neurosurgeons does the Congo have? I think it's like 12, right?
No, so far we have 7.
7.
4 in the capital city, yes. 2 in Bukavu, east of the country, and 1 in Lubumbashi.
Okay, well, maybe you know the answer. Is the government trying to recruit neurosurgeons from other parts of the world? For example, China or something else, some other country?
Sure. Now they want to open school of neurosurgery here in Congo. So they'll be training locally neurosurgeons here. I think by next year, the school will be open.
Okay, that's good.
Sure.
Okay, more comments, questions? Koseka Heel, Africa. How you doing there?
Dr. John, Professor Víctor está aquí. Debe iniciar la presentación, ¿no?
Yeah, okay. I'm sorry, somebody has a comment? Go ahead.
Hello.
Lakuya, go ahead.
Hi.
Hi.
My name is Adria. I'm from Brazil. It's not about that subject, but I'm very interested to know about the coronavirus in Congo, please, if possible.
It's a little off the topic, but certainly people can remark. That's all right.
I'm
It's
curious.
like a town meeting. Just bring up whatever you want. Okay, we'll discuss about the coronavirus later. Sorry, Adria, we'll just talk about it later, okay?
Hey, John, how are you?
Hey, how you doing? Come on, jump in, ask the question.
I'm just afraid to see how this presentation was thoroughly explaining us what's going on in Congo. I think the situation is generally in everything in French community countries, they have these limitations because most of the training and then programs to train surgeons, everything it's in English spoken speaking countries, if I can say. So something I can advocate. So French country they have to do something like to be together and then find out how to improve the training or in trauma or whatever.
Did you hear the question, Hanga? Dr. Hanga?
Sorry, sir.
Did you hear the comment?
Yeah. I've heard the comment.
Okay.
I've heard the comment. What is happening in Congo? We are here in Uganda, and we are following by radio and TVs, and things seem to be under control. The coronavirus outbreak seems to be under control as by information we are getting, and that is a good thing to hear from there, because that is our home, our homeland. So every time we are checking information and we are having information like things are under control, and as a good Christian, we are praying for that.
Well,
Thank
you know,
you, sir.
Dr. Hanga, we can actually have that as a topic next week if people want. Just state of the coronavirus in Africa. If you guys want to have a presentation, and we Adria, we could talk about that, what you were talking about.